The adjustable gastric band has been very popular in the United States, and especially was popular overseas. This is a band. You can see it comes in a linear form that we put around the stomach and we close it down. This goes around the upper stomach. This port, which is a little reservoir, and we use the term port for some other things, so just be aware of that. This little reservoir is under the skin, and that's how we can inflate and deflate the band in your abdomen without having to go to surgery. We can do that very easily in the clinic. That's made of silicone. I'm not aware of any patient who's ever been allergic to that, but it certainly is a foreign body and does have some risks there. It has been FDA approved since 2001, but was put in Europe and South America probably even for more than 10 years ahead of that. It's adjustable, but I think sometimes people have the misconception that they'll just get it adjusted up, they'll lose their weight, and then they'll either have it removed or have the fluid taken out. And unfortunately, when you take the fluid out or when you remove the entire band, weight usually comes back for most people. The appetite comes back and the weight comes back. So while it is theoretically reversible or removable, that's not the intention. The intention is for it to be there permanently and used permanently. Now, a few of the relative disadvantages of the band is that diabetes really only changes as you lose weight. With some of the other procedures that we're going to see, there are differences where the diabetes actually is directly impacted. The adjustable gastric band does have the highest rate of reoperation over the long term. So while it's a very low initial risk operation, if you have multiple reoperations that have the same or higher risk, your additive risk over your life may actually be higher than with a gastric bypass, arguably. It does have the highest rate of reversal. We do see that foreign body move around where the stomach can slip through the band or erode with the band eroding actually into the stomach, or just people not having the effect. They get 2, 3, 4 years in and it just doesn't seem like they can find a good place where we have them adjusted in a good spot. A lot of people have food hang up more with a band than with any other procedure, and a lot of people will just end up feeling like they're frustrated and having it removed and often going on to either a sleeve or a bypass. The band has really fallen out of favor in most of the rest of the world. The people who put in a lot of them, especially at major universities where they've had to deal with some of the complications from around their general area. Maybe I might even say that the pendulum has swung, I think, a little bit too far that way, where there are a lot of people who won't put in a band at all. I think that might be a bit overreaction, but certainly I think if you're going to have a band, you need to be aware of all of the procedures and go to a center where all of the procedures are equally offered. I certainly can be accused of being too cautious about the band. I will tell you honestly, I really do think it is a very good tool, and if it was the only tool we had, I would enthusiastically put it in almost everyone. I think, however, we do have better tools, so it is probably my least favored tool right now. But there are certainly situations where, for the individual's health, the individual's health priorities, this is the right way to go, even with those uncertainties that we're talking about. People ask me frequently why I had a sleeve and not a band, and my main answer to that is that the band has the highest variability or uncertainty in terms of the amount of weight lost, and I felt that for me I wanted to have something that was a little more reliable. I have seen people have fabulous results with a band, and I have seen other people, through I think no fault of their own, really struggle with this tool. So that's the issue. I think there's definitely some uncertainty with other tools. This is the uncertainty with the band, is will I tolerate it and will it be great weight loss for me? If you understand those issues and we talk, and this is your health priority and that's what you decide to have, though, I really do, I want to reinforce I work for you. As long as it's safe and you understand the relative issues, I am happy putting bands in people, and I'm happy taking care of bands where people have had them already put in at other places. I really do believe that we need to work with people the way they want to be worked with, and so I will help you adjust your band or work with your band if you've already had it placed elsewhere.